Welcome to another episode from the Veterinary Research Channel. Today we will be discussing a recently published case report that explores a rare condition in dogs, Nesidioblastosis, and a potential long-term complication following its surgical treatment. This report, published in the Journal of the American Animal Hospital Association, details the diagnosis, treatment, and subsequent development of diabetes mellitus in a dog initially treated for hyperinsulinemic hypoglycemia due to Nesidioblastosis. Our story begins with a 6.5-year-old castrated male mixed breed dog, weighing approximately 45 pounds, who was presented to a university teaching hospital. 16 days prior, the dog experienced an episode of sudden lethargy and ataxia, or loss of coordination, at another veterinary hospital. Prior to this, the dog had been healthy. Initial blood work revealed hypoglycemia, with a blood glucose level of 33 milligrams per deciliter, significantly lower than the reference range of 74 to 143 milligrams per deciliter. Additionally, the dog's amylase level was low. The owners confirmed that the dog had no exposure to substances known to cause hypoglycemia, such as xylitol. The referring veterinarian treated the dog with Caro syrup to raise the blood sugar and discharged him for observation. However, 2 days later, the dog returned with an even lower blood glucose level of 23 milligrams per deciliter. Further testing revealed that while the dog's glucose was low at 41 milligrams per deciliter, his insulin level was elevated at 40.5 microinternational units per milliliter, resulting in a high insulin to glucose ratio of 129, which was consistent with hyperinsulinemic hypoglycemia. Hyperinsulinemic hypoglycemia occurs when the body produces too much insulin in relation to the amount of glucose in the blood. This can lead to a variety of clinical signs, including lethargy, ataxia, and in severe cases, seizures. In dogs, the most common cause of hyperinsulinemic hypoglycemia is an insulinoma, which is a tumor of the pancreatic beta cells that produce insulin. Given the suspicion of an insulinoma, the dog was referred to the university teaching hospital for further investigation and treatment. An abdominal computed tomography angiogram was performed, revealing mild undulation of the ventral margin of the pancreas, but no obvious mass or nodule. There are also some mildly enlarged lymph nodes and a small cystic lesion on the liver. Despite the lack of a clear mass on the imaging, exploratory laparotomy was recommended with a potential partial pancreatectomy. During surgery, mild palpable changes were noted along the left limb of the pancreas, and this portion was removed. 2 lymph nodes closely associated with the pancreas were also removed, along with a small nodule on the left lateral liver lobe. Histopathology, or microscopic examination of the tissue, revealed suspected Nesidioblastosis of the left pancreatic lobe, along with evidence of chronic, mild pancreatitis. The pancreatic tissue showed an increased number of endocrine islets, with numerous small, disorganized clusters of islet cells scattered throughout the tissue. These clusters were often associated with small ductals. The liver nodule was diagnosed as nodular hyperplasia, an incidental finding, and the lymph nodes showed no evidence of neoplasia. Nesidioblastosis is a rare condition characterized by the hypertrophy and hyperplasia of pancreatic islets, leading to hyperinsulinemic hypoglycemia ***. It is considered a relatively novel disease in veterinary medicine, with limited published cases. The diagnosis can be challenging, as it often requires histopathological examination of the pancreas to differentiate it from insulinoma. Following the partial pancreatectomy, the dog's hypoglycemia resolved, and he was discharged from the hospital in a euglycemic state, meaning his blood sugar was normal. No immediate or long-term medical management was required for hypoglycemia. The dog remained clinically normal for 2 years. However, 2 years later, the dog presented to the referral veterinarian with weight loss and polydipsia, or excessive thirst. A diagnosis of diabetes mellitus was made, and the dog responded well to exogenous insulin treatment within 6 days. This case raises important questions about the long-term consequences of partial pancreatectomy in dogs with Nesidioblastosis. While the surgery initially resolved the hyperinsulinemic hypoglycemia, the dog subsequently developed diabetes mellitus. The article notes that this is the first reported case of a dog developing diabetes mellitus after a partial pancreatectomy for the treatment of Nesidioblastosis. The pathogenesis of diabetes mellitus in this dog is not entirely clear. The authors discuss several possibilities, including the amount of pancreas removed during surgery, underlying pancreatic pathology, and other factors known to contribute to diabetes mellitus in dogs. While it's possible the removal of pancreatic tissue contributed, it's unlikely the sole factor given the 2 years of euglycemia. The authors suggest that other pathologies in the remaining pancreatic tissue could have contributed, or it may have been unrelated to the pancreatectomy. Diabetes mellitus in dogs is considered a multifactorial disease. Possible factors include cell-mediated beta cell destruction, insulin resistance, genetic defects in beta cell function or insulin action, chronic pancreatitis secondary to endocrinopathies, and other hormone defects. Hormones such as glucagon, somatostatin, pancreatopolypeptide, growth hormone, gastric inhibitory peptide, and glucagon-like peptide 1 may have been physiologically altered in this dog. This case highlights a potential long-term complication of surgery, diabetes mellitus ***. It also raises the question of whether a pancreatic biopsy should be performed in patients without a discrete nodule on advanced imaging or on exploratory laparotomy to determine if there is beta cell hyperplasia versus neoplasia. This may help with prognosis if there is beta cell hyperplasia and may determine if surgery versus medical management is necessary long-term. It is possible that long-term management with drugs such as diazoxide, glucocorticoids, or capromorelin may be beneficial to dogs who have this condition, with no evidence of neoplasia and without severe or refractory hypoglycemia. The authors also emphasize the importance of considering nesidioblastosis in dogs presenting with hyperinsulinemic hypoglycemia, but without distinct pancreatic masses. While surgical management can be effective in resolving hypoglycemia, the potential risk of developing diabetes mellitus should be considered. Further research is needed to determine the optimal management strategies for dogs with nesidioblastosis, including the role of medical management and long-term monitoring for complications. The article concludes that nesidioblastosis should be considered in dogs without distinct pancreatic masses with hyperinsulinemic hypoglycemia. It is unknown if the risk for diabetes mellitus increases with surgical management, but it did happen in this case. Medical management may prove successful as with other cases, but more cases and long-term outcomes should be investigated. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.